It was my hobby before I had gotten sick to do long distance charity rides, so it was in my, just one of the things I used to do. Every year we would do Bike for Breath with Team Second Wind, and I just trying so hard to be active and athletic and live life as fully as possible and honoring our donors and using our new lungs as fully as we can.
As people affected by lung disease, we wanted to support an organization that helped promote air quality as well as help support people with lung disease.
I'm not sure if a lot of our audience knows really what Breathe California is.
Yeah, we're a lung and environmental health nonprofit. We were founded in 1908 right here in San Francisco, and we are working to fight lung disease, advocate for clean air, and promote public health.
Sequoia Healthcare District chose to invest in Breathe California because we have concerns about the epidemic of lung disease. Asthma, for instance, is on the rise. We have a very populated community now. We're concerned with the traffic congestion and the air quality. We believe in what Breathe California does in terms of providing education, advocacy, and prevention programs. And again, we don't have anyone else doing that in our communities.
And we have a big number of people that is still continue smoking. Like me and my family, we didn't recognize that the secondhand smoke is affecting the whole family until we learn. And if we close some programs or some part of the program where we are sharing this information with people that is secondhand smoking, how they can be learning, how they can protect themselves. So it's not easy, but nobody else is telling you, but Breathe California is telling you through these classes what exactly you could be doing and how successful you're gonna be if you follow the instructions.
Breathe California is a really important element of the grassroots advocacy network in California. Well, if you look at the history of tobacco control, both in California and all over the country, the power has always come from the community level and the grassroots level. And organizations that help develop and embody that and manifest it to the policymakers, both locally and at the state level, have been the key to all the progress that we've made.
I had just moved here to the Bay Area back in 1996, and I had only lived here a couple of weeks. I went home from work, and I walked in the door, and I saw my one-year-old child, and he was laboring for breath where his actual stomach was concaving, and I can see his ribs. So I rushed him to Marin Hospital, and they actually put him in one of those ventilators, and they said he had RSV. It's this respiratory virus that's airborne, and you catch it. And they said it was a 50-50 chance of survival rates. So he was in the hospital close to a week. I slept in that bed with him for close to a week, and he survived it. But after that, he had severe asthma, and they said he would have that for the rest of his life. So I looked at Breathe California, and I tapped into your resources and your knowledge in order to help my son live a very healthy life. And today, well, he just turned 21 years old last week, and he is asthma free. And it was all simple things, advice that I received from Breathe California.
People with pulmonary fibrosis or COPD or emphysema, bronchiectasis, they don't always have a place to go, a community. And as a patient, I think I would be dead if I didn't have fellow peers with my disease to talk to. So I think in many ways, Breathe California is the umbrella organization for all people living with lung disease, including asthma, who are struggling to get by with the difficulty to breathe.
I'm encouraging people to support organizations like Breathe California, who are doing things to make everyone's lives easier.